Talk to me about sinus surgery. I've seen some patients that was the key to their asthma getting better. Why is that? Tell me about sinus surgery.
So there are a lot of patients with asthma, and in fact, this is my experience with asthmatic patients. You have to really dig and ask them about the sinuses because they're so focused on the lungs. That's understandably, oh, I can't breathe. I don't care about my nose and sinuses. But once you start talking to them, and if you go looking for it, I have a low threshold to get an x-ray of the sinus or a CAT scan of the sinus because I'll find often severe sinus disease or polyp disease, and that is part of this inflammatory pathway. There's also the aspirin sensitive asthmatics.
Now what is that?
Those are patients who, if they take aspirin or other non-steroidal drugs, will get itchy eyes, sneezing, congestion, and asthma symptoms.
So that's a very, very serious thing. Those are usually people with polyps?
Polyps, yes.
So we've got aspirin sensitive people, we've got sinus disease. Does sinus surgery, or you just have to treat with nose sprays?
Well, you can try medical therapy first, but there's a lot of those patients that fail medical therapy and need surgical therapy and then back on medical therapy. But there's no doubt that if we get those sinuses controlled, they do much better. If we get their polyps controlled, if we get them desensitized to aspirin, big difference in their sinus disease, almost night and day in some of them, if not most of them, and then their asthma control improves as well.
Sinus surgery, how does it help the sinus disease?
Sinus surgery improves ventilation and drainage.
So lets the air get into the sinuses and lets the sinuses drain.
Correct. And if it can ventilate and drain, it doesn't tend to have all those inflammatory changes and infections that we see.
Allergy skin testing, you mentioned to find out some of the driving triggers of asthma. Does allergy desensitizing help asthma sometimes?
Absolutely. So if you look at what is the largest predisposing factor to asthma? It's allergies, okay? So people with allergic rhinitis, children with allergies, those are the ones that are highest risk to develop asthma. So if they're the highest risk to develop asthma, controlling that allergic disease with avoidance, with good medications, and with immunotherapy is a great way to improve their asthma control. In fact, in children, there's a growing body of evidence that allergen immunotherapy or desensitization to those allergens will decrease their risk of asthma persisting into adulthood. This is the first thing in my scope of practice where you have the chance of taking away their asthma.
And that's a beautiful thing to be able to do. If you've got somebody having trouble at an early age, to be able to start treatment that makes it where they may not have chronic asthma later on.